federal government says it would activate surveillance measures for inbound passengers from China following the current surge of a respiratory virus. Reports indicate that the virus has led to overcrowded hospitals, emergency measures, and public concerns in China. The human metapneumovirus has seen cases spiking across northern Chinese provinces in the cold season, particularly among children. Neighboring countries such as Cambodia, Taiwan, and Hong Kong are closely monitoring the situation, having reported a few cases but no widespread outbreaks, according to reports. Meanwhile, health authorities here in Nigeria are already implementing emergency measures to monitor and manage the spread of the HMPV. And joining me to look at this issue is Dr. Jide Idris, who is the Director General of the Nigeria Center for Disease Control, NCDC. Thanks for joining us, Dr. Idris. This outbreak, the human metapneumovirus in northern China, naturally brings back memories of COVID-19. While we know that the HMPV is not yet classified as a global health emergency, what else do we know about this?
Well, we do know that it's been one of the causes of respiratory problems in children over the years, especially bronchitis in children. In addition to, and it presents the same way as the COVID virus. It presents the same way as the influenza virus. They're all in the same class. So far, we've not detected here because, as a matter of fact, we don't usually test for it until now. I know we continue to test for COVID, but now that this alert has been given to us, yes, WHO has not declared any emergency so far, but it's also a call for us to be prepared for any emergencies. If you remember, this is precisely how COVID started in those days. So what we are doing so far is to enhance our preparedness and response levels. And we've taken a couple of measures. One of them is against to, well, there was a time I read sometime yesterday about WHO declared a fake public health emergency of international concern for this, which is false. So we also wait for WHO to guide us on this. But for Nigerians, part of our preparedness is that we did a risk assessment today because of this, a dynamic risk assessment just to establish a level of risk. And they've come out that that level is moderate, in which case, again, we need to enhance our preparedness. We do not want to be caught unawares. So basically, just like any disease, controlling diseases, there are specific processes we go through. One is that we look at the port health services. So that is where people come into the country, especially from those cases where these cases have been reported. And we're in discussion with the port health services on how best to address this. I know that they themselves have sat down again to discuss how to do it. They are mobilizing their people. They're contacting the key international ports of entry, and they're putting measures in place. Very soon, depending on how we track this, the Minister for Health may need to decide on what protocol to adopt in cases of people who are coming in. But meanwhile, before we get to that, the essence is that to prepare our people ready to face this. The second one is to continue to track, monitor the incidence of disease. Like I did say, we were not specifically testing for HMPV, but we're testing for COVID and influenza-like symptoms. What we've done so far now is that we have a national influenza sentinel sites where they collect and monitor cases of these viruses, they collect data, and they collect specimens from various hospitals and send them to laboratories for testing. To improve the testing for HMPV, we are now furnishing various laboratories, especially the NRL here in Lagos. And some other laboratories, we are going to upgrade the services again to give them the wherewithal where they can test for this by supplying them basically reagents. Because we have a network of laboratories over the country with different capacities for testing. One of them is to improve the testing for HPMV. That's one. That's increased surveillance. Secondly, the other is the public awareness. Whether we like it or not, the public needs to be aware what this HPMV is, just like COVID, It's the same thing. How the disease presents. It's just like a multiple respiratory, cold-like symptoms, flu-like symptoms, cough, sneezing. We let the people know how it presents and what to do, and what are the factors that make it susceptible. We develop protocols for that. We intend to send out again from today. From today now, just to propagating this to people. The other is case management. It's a viral infection. There's no specific drug for now. There's no vaccine for now. You only treat symptomatically. It's just that, again, in some vulnerable populations, it can be serious. Very young children, adults, people, especially them with pre-existing conditions who are immunocompromised, who have chronic diseases like diabetes, cancer, that can reduce their level of immunity. They can easily get disease and it can become worse. It also is that pneumonia, bronchiolitis. And so when those cases occur, we implore people to go to the nearest facility to go and get treated. But more importantly, again, how do we prevent this? And the advisory we've developed advisory now to send out to various people, including the various states. Let the state governments to be ready, get their preparedness response teams ready, provide isolation or treatment centers where they can put these people. We're talking of preparing for IPC, infection prevention and control. And basically, just like most of these infectious diseases, the precautions are slightly similar. One is hand hygiene, washing our hands regularly with soap and water. 2, respiratory hygiene. When we cough, when we sneeze, try to cover so that you don't spread the things. 3, you don't touch surfaces where people are infected, or be your personal hygiene again. And when you have that again, we may, depending on the severity, how we proceed again, we may encourage people to start putting on face masks. But more importantly, in cases, in areas where we have IDPs, where you have overcrowding, like correctional centers, these are areas again where things like this can spread. So we need to get across to let them be alert, being aware, so that we know that. And the ventilation to various homes need to be improved upon. There's no point in closing your doors because this is spread by droplets infection when people cough and sneeze. So they need to ensure that this thing does not spread.
From what you know, from what's happening in China, do we see this escalating very soon? And what sort of lessons can we learn from what happened during COVID-19 that can make it better for us to mitigate the risk of this disease?
From what happened in China, that's like I said, that's how COVID started. We didn't take it very seriously, but now we're taking it seriously because now when COVID came, luckily a number of things have been put in place in terms of how do we prepare for this, how do you respond to this when it comes to this. And that's why I've told you the various processes we go to: surveillance, disease control, detection, laboratories, etc., publicity, and that kind of thing. We have all those systems in place. What we need to do is activate them in the context of HMPV. But again, like this in this country, we're contending with about 7 disease outbreaks. The latest one is Lassa fever. This one seems to have overshadowed. We're going to reactivate that because it's Lassa fever season. But basically, for each disease, it's the same process. It's just that we alter the modalities depending on what is causing the disease. So we are prepared, but again, we are encouraging again. Most of this is happening at the community, sub-national level. So we're in constant touch with the commissioners of health in various state governments. Let them set up again their own preparedness and response teams. We will support them with whatever we have. Like before I said again, we are what we call medical countermeasures. Whatever it is we may need to react, to prevent, like PPEs, face masks, hand hygienes, all those things. We expect people to stock them. We are stocking at the national level, and when these things happen, we send them to the state. The same thing needs to stock. But again, this is part of the thing. We need to let the people know. Hand hygiene, what to do to prevent this. You need to face masks and that kind of thing. Wash their hands properly. These are basic things again that actually cross across to most of these diseases we're dealing with.
So basically, Nigerians just have to improve their hygiene practices.
Oh, definitely.
At this moment, it's very critical.
Not only this moment, too. Forever.
Forever. I know it's not a laughing matter forever. But what are your thoughts, before I let you go, on what people say it's the gap that we have in our public health infrastructure?
We have gaps, but over the years we've been closing these gaps. When I say public health infrastructure, there are quite many. One has to be infrastructure, I mean basically the facilities, which basically are not under the direct control of NCDC, under the control of the states or the tertiary institutions. The essence is that they must be ready to take care of all these things again. They must understand how to treat these cases when they occur. They must understand that they need to protect themselves before they protect others. That's one. We need to communicate with people in terms of public awareness, what this is. That's three, surveillance. How do you detect this? We train people on how to look at data, follow trends. We monitor this periodically. Once we see any unusual rise, is a trigger. We send people out to go and investigate. We need to do public laboratory detection. That's a part of this thing again. Develop laboratory systems, which we have worldwide. We have a laboratory network. I mean, different laboratories in different states, again, there are different stages of development. The idea is that we need to upgrade them, just like, for instance, when mpox struck, we optimize different laboratories where those mpox so that they can be able to detect and characterize. In terms of surveillance, again, we're going to the latest models of genomic surveillance, which is easier. We can detect quickly and we can characterize. And you know, these viruses, again, they mutate, so that's exactly why they say that you have variants of under monitoring, variants of interest, and variants of concern. When it becomes a concern, that's where WHO comes in. So those are the things we are developing, those public health capabilities. We're in different stages, we will continue to improve. The more important is that the improvement has to be at the sub-national level. This is where the difficulty and gaps are.
Thank you so much, Dr. Jide Idris, who is the Director General of the Nigeria Center for Disease Control, NCDC. Thanks so much for joining us on Newsnight.
Thank you for having me.